doctors, good day dear dental students. My name is Alexander. I'm a general dentist and I welcome you on our YouTube Rubberdamology channel where we learn self-training education for application rubber dam in the mouth cavity of patients during your clinical work. And today we're starting very complex exercise which combine therapeutic skills, orthodontic skills, and of course rubberdamology skills. I want to talk to you about fixation of orthodontic retainer for upper jaw with rubber dam. Why rubber dam? Because all of us believe in bonding theory, and if you make in bonding you need rubber dam isolation because you have ability to apply aluminum oxide work with this model. Without rubber dam it's not safe for patient. And for this exercise, as usually, I use Nicton rubber dam plates. I think this is the best plates for rubber dam for everyday therapeutic and prosthetic work in clinic, and of course for making exercises. We're using medium density of these rubber dam plates. Let's discuss about clamps for this work. I take 3 sets of clamps for you. I have 3 sets of clamps today, and let's discuss all of them. Maybe we're using clamp with wings. Also we can use wingless clamps. We can use blinker retractors B4, B3 and B2, and we have additional special clamps with gingival retractors B4, also very useful for this work. I decide to isolate tooth from 5 to 5, 15 to 25, and I choose clamps. My favorite 2 clamps, wingless. Clamp W2, because we have without wings, it's smaller, and I have more space to working with instruments and retainer tip in the palatal side of tooth arc. Open clamps. And start fixation our rubber dam plate to frame. Don't forget about this curvature, and we need to put our rubber dam proper way. This is good. And if you made another variant, sometimes even for teachers I see placing rubber dam over the frame, and I think this is idiots, and this is mistake. Make only proper movements and proper stages for your work. Very nice. We isolate 10 tooths from premolar to premolar, and a good strategy to start perforations from the upper quadrant symmetrically to left and right side. Don't forget to test rubber dam stability, clamp stability. Place after maybe anesthesia if you need, but in many cases orthodontic patients don't need anesthesia to fixation retainer. Check stability of clamps, very nice. I show it from another camera. And remove clamps. For premolars, I select middle perforation diameter at the puncture and starting to perform perforations. First, central incisors, reduce size, lateral incisors, increase size of perforations, canines, very nice, and the same size of perforation to premolars. I think without templates it's very symmetrical, it's very easy. Don't waste your time to draw points in templates and then start the perforations. It's not need. You don't need it. Increase your skills with our exercises. Then put clamp inside one perforation and the same input wingless clamp W2 to the perforations in such way. Detach retainers. Take a clamp forceps. You need a good tension between upper retainers and fix one clamp and hold it with stopper. Then ask your patient to open mouth, place clamp to second premolar from the left side. Try to catch clamp in the mouth cavity of your patient and hold it with the forceps and put it to the right second premolar. Very good. Then your assistant can help you, or maybe do it with yourself. Collect the old rubber dam plate and fix maybe corners, maybe all retainers. Very nice. In some cases, don't forget to put cotton to the middle to protect skin from this metal point. It's not comfortable. Very nice. Then we start to making rubber dam straightment over all tooth. Open clamp. I take it with these pillars. I don't use fingers to work inside this part of mouth cavity. And then stretch rubber dam and put it in interdental spaces. Orthodontic patients have not very strong contact, so it's not problem for you. Like in my plastic model, the same situation. And then using floss to check in some different and difficult situations. In some cases you need additional instrument like dental floss to check interdental contacts. where we start to receiving problems with this technique. If our patient have small size of teeth in childs, in girls, and after you making inversion of rubber dam, you may decide in what areas you did not have enough space from the palatal side. Typically, if the second lateral incisors have not enough space at the palatal side, and we need additional fixation, I open gingival retractors B4 and place two retractors to the lateral incisors. What technique you can use? Catch small piece of rubber dam and pull it down and place clamp. Very easy. Now we have all set up for fixation of orthodontic retainer with the rubber dam at the upper jaw. Maybe you need to test how long retainer you need. Very often I receive patients which broke their retainers between premolar and canine and incisor from the both side, or maybe not carefully fixed retainer. It's also a problem. And for this work, I ask you to take a floss and cut part of floss as long as you wish to fix the retainer, to measure the volume of retainer you need. I put floss to the palatal side and I decide to fix it with first premolars. Ready. Make mark with this marker. Very good. We have a mark. And then prepare your retainer. I'm using SRW retainers, standard retention wire. It's very comfortable for patients because it have pressed profile and it's very good, it's very interesting, very nice. Cut and the length of retainer you need. We connect retainer with this floss measurement and find where mark is. Also make the same mark at the retainer. Now we have enough information. Then we need to cut a retainer. Very good. And now we're ready to adhesive technique with our patient. First of all, excite aluminium. And premolars. Then etching gel. Making dots with our phosphoric acid. Also for premolars, don't forget. Nice. In this kind of work I did not activate etching gel. If you wish, you can try to activation, but this surface is very small and it's not so useful. Collect all acid. And then flush with the water. Of course, it's very useful to make envelopes from all sides of your working area to collect water in the rubber dam without and have a clean space working space. Okay. And dry with water, with the air, all surface from vestibular side and palatal side, of course. Deciding what bonding system you want to use. Single component. It's after aluminum oxide, it's no matter, because you have very good fixation. If you have time, you have rubber dam, it's better, of course, to take dual component bonding system. OptiBond is very famous for this kind of work. But maybe you are fan of Ivoclar company as me, and you want to work with 3-component bonding system. Let's try. We have first component, Syntec primer. Apply all this bonding agent to surfaces where you are applying etching gel. Dots, only small dots. If you have not enough bonding or primer, take additional. blow it with the air. The second component, adhesive. It has very interesting smelling. Also blow it with the air. In such technique, it's no problem to using complex bonding system. And then of course, light curing bonding resin, helio bond. Brinker retractors don't make me problem because I have enough space to work with microbrush from all sides of this tooth. And you don't need to put clamps to all tooths, but in some cases I connect these clinical cases. I connect real clinical cases of such technique in our learning management system in the Rubberdamology.com website, and you may compare this exercise with the real work in different cases which I put brinker retractors to all tools, all incisors, canines, premolars. It's complex work, it's very hard. In some cases I don't need brinker retractors, no one, only anchor clamps, and it depends on your clinical situation. Then we cure bond. In this work I change the mode of my lamp to pulse mode. Maybe we have another lamp with ortho mode, 3 seconds 10 times. Very good, it's more comfortable for me today. And then we try to fix retainer with the smaller number of flosses and clamps and any additional accessories. Making double ligature, or maybe one ligature, no matter. Loop and fix it at the middle of your retainer. Very easy. And now you're ready to fix your retainer to tooth. When I start to think about this method, I using the part of glove that I fix for all tooth, and I made flosses which I put in all interdental spaces over retainer and fix a retainer from the palatal side and the part of glove at the vestibular side, and I think it's very very good. But today I think it's just a losing of time, and now after you think about it, such fixation, in some cases this is not a problem, but in some cases you lose time. So I decide to change my strategy and fix retainer directly only with floss, without any additional part of glove. For the first point, you need to fix retainer in the proper position. To ensure your patient have enough occlusal space to close the lower jaw. In some cases my assistant can help me, but today I simply place retainer as epically as I can. Place very small volumes of composite for first point. Hold only one floss I hold, and cure both left and right tooth. Very nice. Check fixation, normal. And then we need a tweak with this floss. I put it in interdental space, and then put it under a retainer and pull back to vestibular side, and then again pull under retainer and pull back to fix retainer again. I made only 2 loops for lateral incisor because I want to remove clamp brinker B4 from tooth 21 and 11. Don't make knots, only loops. Very good. I even don't need to hold retainer from vestibular side because I have very good tension of floss. Put additional composite and cure. Now I can remove brinkers and fix it to premolars. Не 2 минутки, я уже заканчиваю. it's a good strategy to have enough space from the palatal side of premolars. Sometimes you did not have enough space in this area. Continue to making loops around our premolars and canine. Deep in under interdental space. Remove very small space from clamp and pull back. Very nice. And pull back to fix retainer in last interdental space. Very nice. Fix it with this very small. Today, in these points, I hold my floss. If you need additional tension, and then immediately cure from both sides. At least we can fix this tip of retainer only with this. Maybe we made fixation with floss ligature, no matter. The same way, the same tactic immediately. If you decide. But I think this is not comfortable and it's faster for me just for holding retainer with this instrument and put composite and cure. The same from the other side. It's not hard. Put some composite. If you're working with the assistant, it's much easier in this technique. Make additional fixation of composite of these tips. This but for plastic I have not very nice fixation. I remove unnecessary composite, bend my retainer, and glue it again. After that, we need to enforce all fixation before we remove the floss. ready to remove clamps, blinkers. Sometimes blinker can be crushed. This is a half of blinker. That's why very safe to work with Rubberdam, because all of them removed. Additional and this very important, to cut unnecessary part of Rubberdam, unnecessary part of retainer. And of course close the cut shape surfaces from the mouse cavity with very small volumes of composite. And enforce for all tooths additional part of composite. Don't glue your floss. Be careful with this work. Repeat it for all tooths in this work. And then cure very carefully. And now we're ready to remove our floss. It's very easy. Hold your floss with this pillars, and maybe you cut this knot, maybe you remove it very carefully. Just now. Very nice. Removing Rubberdam from the station. You need scissors. You pull interdental part and cut. Very nice. Then we're removing anchor clamps from the second premolar, and we're ready to detach Rubberdam from all tooths. And we have fixed orthodontic retainer. Maybe you wish to polish with enhance all these services. Thank you for your attention during this long exercise. I think this is very useful technique for making very good retainer fixation in our patients. Feel free to ask questions in the comments below. Don't forget to press the like button and share it with your friends. Thank you very much. See you soon.